I work towards creating an awareness among people, community members, parents, guardians, youth, about the dangers and risks associated with substance use. So we want to educate and inform, and that will help us see a reduction in negative outcomes of alcohol use, illicit drug use. My name is Derrick Vickers. I'm a program specialist for Insight Human Services. Insight provides substance use prevention programs in 13 counties across North Carolina, including Rockingham. Insight Human Services' mission is to provide the highest quality care to prevent, reduce negative outcomes related to substance use and mental health in the communities that we serve. We believe healthy living begins at Insight. Some of the services we provide in Rockingham County are youth prevention education. Insight employs certified instructors when delivering youth prevention education in Rockingham County. Insight has provided programs such as HALO, Healthy Alternatives for Little Ones, at Little Angels Daycare and Trinity Wesleyan. Preschool is the perfect time to learn positive life skills. In fact, studies have shown that lifelong values are formed at this age. HALO adopts a positive, loving approach that empowers children with knowledge and confidence. HALO promotes understanding choices as either healthy or unhealthy rather than good and bad. Certified Insight staff have delivered bullying prevention program at Dillard Academy. This curriculum gives youth the tools to understand what bullying is, how to identify bullying and react, best practices when reporting bullying to trusted adults, and what to do if you're a bystander who sees someone being bullied. At James Holmes Middle School, we implemented Too Good for Drugs programming. This is another evidence-based program that has middle school lessons to address the developmental risk factors associated with the use of alcohol, tobacco, and other drugs. These topics are discussed in the context of expectations, peer pressure, influence, and the role of media. Through this program, teens develop the knowledge, skills, and attitudes needed to make healthy decisions and resist substance use. In 2018, there were over 10 million opioids dispensed in Rockingham County. In 2019, Rockingham had the 7th highest opioid overdose rate in the state. Through a communication campaign called Lock Your Meds, Insight was able to distribute over 200 lockboxes, over 250 at-home disposal kits, and over 1,800 informational brochures. It is proven that secured medications in the home and medications that are appropriately disposed of can reduce unintentional overdoses and poisonings. Another prevention service provided in Rockingham County is SINAR. SINAR is compliance checks at retailers who sell tobacco. In 1995, according to Youth Risk Behavior Survey data, 38.7% of youth who smoked reported that they got the tobacco they smoked directly from the retailers themselves. In 2011, that number was 14%. Compliance checks ensure that retailers are following policies and guidelines when checking IDs and reduces access of tobacco to youth and minors. From July 2019 to December 2019, Insight completed 97 compliance checks in Rockingham County. In September of 2020, we completed an additional 77 compliance checks. Insight Human Services provides seminars at the community level, working with church groups, civic groups, and other community-focused agencies. We want to educate and inform residents about the issues related to substance use of alcohol, tobacco, and other drugs. We provide information tables at community events like Lot 2540, the Reedsville Senior Center, and we're currently working with Jeff Pruitt on the Rockingham Symposium. Additionally, there are Insight staff who sit on boards and committees across the county that are focused on making positive impacts in your communities. We are members of the Opioid Task Force. We sit on SPARK, Suicide Prevention Awareness of Rockingham County. We're involved with the Rockingham School Health Advisory Committee. We also attend the Be Healthy meetings and support the Reedsville Post-Overdose Response Team. You know, parents and guardians, they talk with their youth about buckling up, always wearing your seatbelt. But are they talking to them about the dangers of misusing substances? Do adults and community members know that if someone who consumes their first drink before the age of 15, they're 4 times more likely to be alcohol dependent once they get older. So having that conversation with youth about the awareness and dangers of substances like alcohol and tobacco, secured and monitored storage of alcohol in the home, prescription medications in the home, and just talking with their youth, making sure that they are aware of the issues of substance use. I also like for parents and guardians to share this information with other parents and guardians. Parents talk a lot more than youth think they do. And if they were talking about the right things, if they were talking about certain things, we would see a reduction in youth substance use, which in turn is a reduction in adult substance use. When people know better, they do better.